Everyone. Thank you so much for joining us for today's discussion on designing gender assessments in DFSAs during COVID-19, the first event in a three-part series. I'm Ellie Sukup, and I serve as the Food Security Technical Officer on IDEAL. This event is part of IDEAL's COVID-19 Food Security Learning Series. With the series, we are providing opportunities for USAID's Bureau for Humanitarian Assistance funded development and emergency activity implementers to share their experiences among peers as we are all adapting in light of COVID-19. This event is part of a specific learning stream focused on addressing at-risk populations and a follow-on event to the session we held about gender integration in DFSAs during COVID-19 on June 30th. If you want to know more about our other learning streams, please visit the FSN Network website. Now, I will turn it over to my co-host, Amy Eibold. Over to you, Amy.
Thank you, Ellie, and thank you everyone for joining us today. I'm Amy Eibold, Mercy Corps Senior Advisor for Adolescent Girls and Youth based in Portland, Oregon. And as Ellie mentioned, we are all facing new challenges presented by COVID-19. And these challenges demand that we adapt how we implement activities within DFSAs, and how we approach different assessments and analysis. So during IDEAL's June 30th event, as well as subsequent key informant interviews, many of you identified 4 issues that are critical to address in our programs if we're to remain responsive and impactful in light of COVID-19. So these issues that were brought up by all of you include, first, the shadow pandemic of GBV. There's been a sharp increase since COVID-19. Second is the loss of women's livelihoods and looking at different strategies on how we can protect those livelihoods. The third is the intersection of technology and gender and how we can safely leverage technologies in our activities. And then the fourth is today's topic, and that is the increased challenges when it comes to gender analysis, gender assessments, and integrating gender into different assessments. So this 3-part series is focused on how we can adapt, but also how we can do analysis and apply this data to our programs. So in these interviews in the June 30th event, what we learned is that there are no systematic approaches to conducting gender analysis or assessments across peer agencies, and there's a need to learn on how we can improve, adapt, and evolve these tools and approaches. So today we're going to focus on how we're all collecting data, the tools and approaches that we're using, and what's been successful, what are the challenges, and advice that you have for your peers. And a last note is that we are calling this a peer exchange because we want to emphasize that you are the holders of knowledge, that you bring expertise to the table. And we want these exchanges to provide opportunities for inclusive participation and learning. We want this to be a safe space where you can talk about your wins, your losses, your challenges, and your solutions. So from these 3 workshops, our goal is to develop a set of streamlined recommendations on approaches and tools that can be used in the future. And these recommendations will be shared after the series is complete. So with that, I'm handing it back over to my colleague, Ellie.
Thank you, Amy. So now, before we dig in, we would like to invite you to get to know each other and each other's context a bit more deeply in some introductory breakouts. Once in the breakout, which you will be assigned to automatically, so you don't need to do anything, you'll introduce yourselves and then share one success and a challenge that you have faced in designing and collecting data for gender assessments or integrating gender into assessments. You can refer to these instructions on slides 10 and 11. After discussing as a group, please choose a scribe who is comfortable in Google Slides who can add 2 to 3 successes and challenges to each of the following slides while you are in your groups. You will have 10 minutes in your breakout groups. Then we will come back together and we will discuss what you've all come up with. Enjoy. I hope it was a good conversation for all of you. I hope you got to know each other a little bit better. So, as we're looking at the slides here, of course, please continue to add your information, your challenges and successes to the slides themselves. I think you've all found it, but slide 13 and 14 is what we're on right now. So for slide 13, All right, this is fair. It looks like we have significantly more challenges than we do successes, and I think that's why we're here today. But it looks like this is wonderful. So thank you for that. With that prompt, now people are adding more into successes, which is great. But I think, looking at resilience among female staff who are able to be creative and build their capacity to collect data, that's been a success. Integrating gender into market assessments with equal representation of male and female respondents, gender outreach groups and gender model families, using more virtual events to share knowledge and data. That is fantastic. I think if anything, COVID-19 has showed us not only how resilient we are, but how creative we are as well. So capturing this information is absolutely wonderful. Now for the challenges. Yes, connectivity. And I think that this is a challenge that we will be facing today, even. It's just hard when we're all relying on virtual platforms. Unfortunately, we also have shorter, less informative responses when interviewing over Zoom. I can attest to that. With remote data collection, having to ensure representation of different vulnerable groups. We all know that different groups have different accessibility to technologies, et cetera. And so how do we really reach the people that we need to be reaching is absolutely a challenge. The usage of gender analysis findings. Some of the projects designed are already designed. So how do we do the gender analysis? Fortunately for you, while this particular session is focusing primarily on designing the assessment and data collection, our next workshop will be on gender analysis. So stay tuned for that. Again, inclusive sampling. It takes longer to collect data. It's tricky to get information during the lockdown. Yes, I'm seeing a lot of access challenges. We're relying on Zoom, we're relying on technology. How do we reach the right people, and how do we just reach people, period? It's harder to collect gender data when women in some areas do not have or use technology, absolutely. With remote collection, integrating gender into other assessments is more limiting. Yes, I think that COVID-19 has presented challenges not just for gender, but for all different types of programming and for different populations. And so how do we make sure that gender is still integrated into those other assessments? The diversity of communities that further marginalizes them. Heterogeneity of household structures in specific regions, yes. Normal challenges have become even more amplified during the pandemic. And gender analysis is done after the project is designed, so the findings are not often used. Yes, again, gender analysis. So this came across very much during our key informant interviews, and that is why we are having a 3-part series on gender assessment. Not only is data collection a challenge, but then the analysis is a challenge. And once you have that information, what do you do with it? So that's what the 3rd session will focus on. Diversity of communities, local dialects, ethnicity, it makes it difficult to ensure comprehensive targeting. Absolutely. And then the unfortunately, I don't speak French. But I'm based off of my high school Spanish skills, it looks like limited information. Absolutely. These are all very, very valid challenges. And our goal for you today is that we're going to work through these challenges. We believe that you are your own best resources, that maybe something that has worked in Bangladesh may actually work in Uganda as well. We wanted to bring you all here together to share your challenges and brainstorm together about what can possibly work. So with that, thank you so much. I'm going to hand it back over to Amy, and you can all look to slide 15. Amy, over to you.
Thank you, Ellie. And what we'd like to do now is talk a little bit about the key themes that emerged from the June 30th event that we'll be discussing today. And they absolutely echo some of the challenges that we've all brought up in our previous Get to Know You activity. So from here, there were some key themes, and the first is limited mobility and access. So yes, you had all mentioned it across the previous discussion, but as well during Key Informer interviews and the previous event. But there's limited mobility and access because of COVID-19, which means it limits our access in terms of speaking with individuals and households. And of course, that impacts how we collect primary data. This will be breakout room number 1, and we will have a discussion around that theme. The second is, yes, we are being forced to rely on secondary information, and that's going to limit any new insights we might gain, as well as the quality of the data if we're not able to access new data and see what's happening in the landscape of COVID-19. That's our second discussion for today. The third discussion is going to center on the use of new technologies and how that might exclude more marginalized populations. And again, I just heard this come up in our small groups, but as we shift away from in-person data collection and toward different technologies, that's going to shape the data that we collect because it shapes who we speak with. And we may be unable to reach or speak with the more marginalized. And then finally, during registration, many of you had brought up that there's limited resources, and sometimes we're dealing with limited capacity as we try to shift and look for new ways to collect data. So that will be our fourth breakout group. And then finally, we have a fifth breakout group, and that will be for our French speakers to discuss these issues. So I'm going to ask you to self-select into one of these discussions and type your name, and once on the stickies, and once they fill up, you may have to choose a different group. So ask us questions in the chat if you're unable to do that or have any questions, and we'll go ahead and sign up.
Can I please ask you, sorry, this is Maya, I'm doing the back end, dividing everybody into groups. Can you please put the name as your Zoom name is so that I can link the Post-it notes to your Zoom name so I know where to put you? Thank you.
Thank you, Maya.
Solomon, not to put you on the spot here, but I was wondering if you could make a similar announcement in French. We want to make sure that all of our French speakers are in the French breakout group. So if you could explain that in French, that would be very helpful. Thank you.
Sure, thank you. Donc, je ferai cette annonce en français notamment. On est en train donc de s'inscrire pour les travaux en groupe et on souhaiterait que vous mettiez votre nom dans le groupe dans lequel vous voudriez travailler. Dans le cas des francophones, vous verrez la dernière colonne, c'est écrit French. Nous vous prions de bien vouloir inscrire votre nom tel qu'il apparaît sur votre Zoom pour qu'on puisse connecter votre nom à cette carte qui est dans ce document. Donc, veuillez écrire votre nom tel qu'il apparaît dans Zoom. Merci. Thanks, Ellie. Back to you.
Thank you. Thank you. And as a reminder to everyone, we are signing up on slide 16.
Thank you, Ellie. And I'm seeing that many people are signing up. I'll just give you everyone one more minute. Okay, it looks like most of us are on slide 16 and are having no problem signing up. So as you wrap up, and before we break out into these small groups, we wanted to set the stage with some storytelling from our colleagues. So I'm really happy to introduce Lavina Awar, who's our gender and young people advisor with the APLO activity in Uganda. She's with Mercy Corps. And we also have Ashrafiz Prodhan, a senior technical coordinator for women and girls in empowerment she's working in Bangladesh with CARE with the Shrohardo 3 program. So they're each going to talk to us for about 3 to 4 minutes and share some stories, challenges, and solutions that they faced collecting data, designing gender analysis and assessments in light of COVID-19. So with that, I ask you to turn to slide 17 and join Lavina as she talks more about her work.
Hi, everyone. On slide 60. I'm reading from a different page, but it's all the same, yeah. So the background of my presentation is not really a COVID assessment, gender assessment, but more of an addendum to the gender assessment that we did as Apollo between November of 2018 and June of 2019. So a couple of things came up in that gender assessment report, which was divided into 2, and thanks to you, Amy. Sorry, can I go ahead?
Yeah, go ahead.
Yeah, so a couple of things came up in the assessment, the gender assessment, which was divided into 2. And one part was for the broader gender component, and then the second part was on adolescents, adolescent consultations, which was to cover for the issues around young people. So beginning March of this year, when COVID happened, it happened that we were also, getting into our new, planning for the new year, financial year. We began our prep plans, and we had some of the lessons we learned from the past year was that some of the adolescents that we had been trained over time, close to 3 years, on menstrual hygiene management products development, like a manufacture of reusable sanitary pads, were actually not using those products. So we were triggered to find out why they were not using these products. And this also happened at the time when COVID was happening, and there were increased cases of SGBV. And as a program, we couldn't rely on information without data. And we had a district COVID-19 SGBV actors group put in place with the support of Masiko Karamoja to address the COVID situation. And then when that was done, we had to work as a team collectively to get data from the community on which villages or which areas were hardest hit by COVID in terms of SGBV. So then we had to do an RRI, Rapid Result Initiative, for the 2 assessments. That's one, around to identify hotspots for SGBV during the COVID pandemic, and then 2, to map out menstrual hygiene, menstrual health management, menstrual hygiene management preferences for adolescent girls during COVID-19. So this, as I said, layered on the gender assessment and AD consultations conducted between November of 2018 and June of 2019. Let me just talk about the challenges. Yeah, remote primary data collection, using mobile phones, email, virtual, or even phone calls was just impossible for us in Karamoja, because the nature of the community that we work with, either they don't have phones, or if they have phones, they do not have power. And getting access to places, to the town centers where they could have the phones charged was also a problem because of the lockdown. So that was one big challenge, access and access to information. Amy, you want to say something?
Well, it's getting really interesting, but I was going to ask if you could share that solution, and then unfortunately we have to move forward, but we will share your slides and also maybe have a few minutes for Q&A. It sounds like you were up against quite a number of challenges.
Okay, so do I go ahead and then I'll come to the solutions?
Yeah, I think we have time to share one or two solutions, and then we're going to hand it over. Thank you.
Okay. Yeah, so we also, there was also the strict COVID-19 prevention and response guidelines also, made it really difficult to collect data or information. People were getting into households or, homes with protective masks. At one point, community members just ran away from us as carriers of COVID. And then the other challenge was privacy, especially in the area of GBV data collection, where you're doing a door-to-door data collection, and they are all, members of the household are all there. And the survivor is there probably, and the perpetrator is also there. So getting that information was somehow a bit difficult, unless the teams were tricked to separate into different groups so that that information could be gathered. There's also the guilt factor from our viewpoint, in the sense of balancing between program needs and the respondents' priorities. At that particular time, the respondents' priorities did not lie around information that they could provide. They needed food, they needed their livelihoods back, they needed to have their sanity, their lives back. So that really made us guilty that we were getting to their spaces to get information that we would use for programming, while evidently that was not in their priority. Then some of the solutions that we use to, to address these challenges, as I mentioned, we used a lot of, door-to-door, data collection. We were literally walking into villages and households because there was no other way of collecting data. And then we also used graphical methods where, for participants or for respondents to better understand SGBV in our context of Karamoja. And then again, as people working in Karamoja, not all of us are locals, so we had to walk along with locals. Just to give a face of their own, and that made the interviews or the data collection process made it a lot more easier. Then of course individual one-on-one meetings. Then my advice is that it would be good. It would be good in times of COVID or pandemic, to integrate assessments to other existing projects. don't just go with an assessment in isolation. Yeah, because definitely it's not their priority. So for example, if we are for us who are providing MCHN services or livelihoods products, we ride on the livelihood products to get information or to collect data around GBV or whatever assessment that we are carrying forward. Then
thank you, Lovina. Lovina, I'm gonna have to ask you to, and I hope that we can continue this conversation in our small groups because we are so tight on time, but I think you've shared some really great solutions that I hope we can come back to, and especially I think integrating gender into other assessments and how we might connect with colleagues and move that forward. But at this point, I do have to hand it over to Ashrafi, so she has some time to talk about what's happening in Bangladesh. Everyone else, we will share Lavina's slides. I hope that we can continue this discussion in our small group. So thank you very much.
Sorry about that. Okay, so I am going to attempt to share a screen because Ashrafi's is
repeatedly hampering in getting connection into the Google Drive.
Yeah, no worries, no worries.
Great help. It has been a great help. You can share the screen.
Yes,
so that
absolutely. So,
sure.
Hold on, just give me 1 second. And
slide 5, 6, and 7.
Yes. Okay.
Just make it a slideshow.
And yeah, where's my presentation?
You take your time and let me give you
I'm under
kind
so
of,
much pressure. Sorry.
Yeah. To maximum use of the time. Yeah.
All right. Hopefully everyone can see that.
You know, yeah, sure. So before going through the highlighting of the experiences so far we have and the journey so far in terms of from the perspective of Care Bangladesh Showardo 3 program, and you have been know that Showardo 3 is the world's largest food security gender responsive program. So it has been really tough for us in our context like Bangladesh, because when the pandemic started in last December to January, we thought about what about our data about gender and women empowerment, because everything was lockdown, social isolation, social distancing, quarantine, everybody are staying at home, and our gender data especially are at the field, and data become orphan data. If no one is taking care of our gender data, it become orphan, right? So we are very much cautious about that, how we can take care of that data and collect it and taking it to our home and analyze. So the first challenge we so far face, it is very common with Lovena and all in our context too, because the women in our context like Bangladesh is not that much well previewed to ICT, and majority of the women and girls do not have the phone, and there is a family restriction in our context like Bangladesh, because in the context of South Asia like India, Bangladesh, Pakistan, and Afghanistan, you know, we have the boundary partner like husband, father-in-law, brother-in-law, mother-in-law, and they are always very much like to regulate and policing what is happening over her phone at hands. Who is calling, why not this time, why not in evening time? So this is really very barrier for women to talk over with phone and collecting information and extracting her views and opinion in respective matter, especially in the domain of household power decision maker, labor sharing at household level, and also, you know, freedom from intimate partner violence. So it was really toughest to online data collection. Also, we face problem in engaging staff because of their capacity. They are not that much well previewed to navigate the, you know, the tools of online conducting webinar and mobile, using the mobile phone for collecting data. And ensure the data quality also become a challenge for us, because it has also consequent with the fourth bullet, collecting sensitive data like GVV and child marriage. So we know that different research strongly highlighted that GVV and child marriage is in rise during this pandemic. So, and this type of data collection on GBV and child marriage really need to physical interfacing and physical, you know, data collection in person, and also need to have a eye contact with the respondent to have a real reflection on that. Because the GVV and child marriage data collection is subject to having perception and practice level information to address the thing. And also, we know that we visit in the field and collect data in the daytime, but during this pandemic, we are not been able to collect data in the regular working hour. So this is the challenge we face so far, but we are not, going down and frustrated. So what we have done in transferring that challenge into solution. So what we did, we just wanted to communicate with our female participants for collecting data through the RMS, and also we did the longitudinal study, and also in support of the USAID Resilience Forum guideline, and also we did the participant-based sample survey. So, and all the data collection methodology have this gender component very strongly covering in responding the COVID response, having a very sound questionnaire and data collection method on especially GBV. So we communicate with women and asking for her time preference while collecting data remotely, because we know that women have been suffering from the time poverty. They have triple burden at home and in the community also. So what time she prefers, we did work on that. And also data collection beyond the regular working hour when required. And personal tabs and smartphone with our frontline staff and the community field trainers, so that they and graduate them, orient them over the data collection method. So when we organize the online data collection, especially conducting the online FGD and webinar, they are there to ensure that they have a good connection and we are hearing their voices and concerns. And the most important solution part is specify a clear ethical guideline and apply do no harm approach, so that after coming from the community, having a online data, there is no unintended consequence of gender-based violence that happen at household level with the respondents. So we are very careful about that, and considering also keeping in mind care and as well as USAID's do no harm policy. Yeah, so we have learned that for online data collection is completely different from the physical one, the in-person one. So considering the time and the situation, women's workload and taking care of the corona patient and quarantine, all the things, elderly, children at schools are closed, all children are at home. So they have so many burdens to prove. So the questionnaire or the data collection checklist or the topical outline should be simple, short and relevant, which give you the more data and realistic information to make a help management to take an adaptive decision. The second one is be empathetic while collecting data, because most of the time our respondents are men and women. But be empathetic in a sense, for example, there is a breastfeeding mother and her baby is crying when you are taking her into collecting information, interviewing her. So please allow her the time to attend her baby and resume the interview later over phone. So this is most critical. And third one, and the most important one, is globally desert become changing. So there are climate change adaptation, there are man-made disasters, there are natural disasters. So we should not wait for anything happening. What is happening where we don't know what will happen for weather, for the environment, for anything, war with women. So we have to be very, very, very ready and get prepared ourselves for as a contingency plan for any pandemic situation, so that our data cannot be sitting idly, or we see there is a lot of orphan data in the field that we are staying at home and there is no bridging between the data and the collector from the online. So we have to be very much prepared and ready to collect gender data at any time in any situation, having contingency plan anytime. So this is the advice for the other. Now, I should actually, I don't like the word advice. I like to see the sharing our experience, what can be done more. And also as a general guideline for all of us, as we are, are responsible for mainstreaming gender and in terms of the current pandemic situation, I think we have to also adhere with the household power dynamics in everywhere in this world, and also the community power dynamics, because when there is an online data collection, because in our context, not only in our context, in Asia, Africa, I worked with Africa a lot of time and in different contexts. Like, so online, that means we can't see each other. We are spirit there. So when we are not facing each other, we are not see each other in person, that means there are possibility and chances of missing so many potential learnings. So we have to be very careful, empathetic, strategic, and diplomatic as well to expansion of the opportunity to taking into consideration to grab or extract the real learning from her mouth, from their mouth, and also considering an enabling social environment so that she can talk and we can hear and we can learn from her experience. So this is the advice and learning and key takeaways for our other participants. So thank you, and again, welcome from Bangladesh. Thank you all.
Thank you so much, and I'm especially appreciative of you speaking to the do no harm approach, especially as we're working through a pandemic and families are very impacted, and reconsidering a do no harm, trauma informed in the way that we collect data. So thank you for bringing that up. Thank you both. And with that, I'm going to hand it over to Ellie to help us break into our small group discussions.
Yes, thank you so much, Lavina and Afshafiz. The information you shared was so helpful, and I think something that we can all relate to. So we really appreciate you sharing and your experiences and your willingness to do so. So with that in mind, we now invite you to join the breakout groups. You have self-selected already the theme that you would like to discuss. You will automatically be placed into those groups. When you are in those groups, we ask that everyone reintroduce yourself and share an example of how you have experienced that particular issue at hand. Then we would like you to discuss what the contributing factors are that created this challenge, and then any adaptations or changes that you made in relation to that challenge. Also, if you have any resources that you used, we want to hear those. The goal of this workshop series is we want to come away with a brief or a tip sheet that everyone can benefit from. So any lessons that you've learned about an adaptation or resource and any guidance you have for how to improve on that effort in the future is really, really helpful. Then we ask you to reflect on all of the adaptations and lessons learned, and your scribe, you can discuss through your groups what you think the key issues or key themes are. And then at the very end, we will all come together and we will share those 1 to 3 highlights from each group. So with that, we invite you into your breakout groups. Enjoy, and we will see you after.
Okay, thank you. I hope that these small group discussions were beneficial, and with an eye on time, I knew we would have a lot to talk about and that we have to wrap up quite quickly, but please know that we will share all of these notes and everyone will learn from what happened in different groups. So I would invite everyone to take a look at slide 28. And this is group 1. And group 1 was talking about limited mobility and access. So very quickly, everyone, I'm going to ask that we truly spend just 1 minute with a highlight or 2 from your group. So can I invite someone from group 1 to share out just one of the solutions or challenges that you shared, and then we'll quickly move on to group 2. So group 1, please.
Rakesh.
Right. Thanks, Kitan. I was volunteered. Right. So there's one challenge that we talked about, Emmy, was in relation to as we were trying to gather the information, especially using the mobile phone during the COVID situation. And even now, if you want to use that technology, we have to consider that, in Bangladesh context, particularly, we were looking at that where, the early marriages, the child marriages is still a big issue. And with these young girls, the young women, if we are trying to collect the data, and if it is a male member who is really trying to talk to a female member who really is really going to respond to that, that is an issue. That is a challenge, really. So that is something that once we are planning something around that, we need to take that into consideration, and the local context issues in terms of the gender sensitivity needs to be kept in mind while planning. I'll stop there, given your 1 minute challenge. So I think that's one of those challenges that we talked about, which I think we can elaborate more, and then you understand where we come from in Bangladesh, right?
Yes, thank you. Thank you so much. And just again, we will absolutely be sharing out with all of you what was discussed. So moving on quickly to group 2, 1 minute to share, please. And that is the next slide, slide number 29.
Hi, everyone. So yeah, our group had a good discussion. We learned about some useful resources and places that people go. So USAID's AgriLinks, looking at various forms of government data and really seeing secondary data as useful so that you can do geographic comparisons, especially if you don't have data that's available for your very local context. And then some of the lessons learned, making sure that we're getting data from reputable institutions, that it's managed correctly to make sure that we can use it easily and that it's accessible, and that we can, one of the areas of future guidance is that making sure that we cross-reference and kind of validate data. So if it's from already existing, we can validate it to ensure that it's still relevant for the current context and the time. So just some quick notes there.
Thank you, Krista. Thank you. And moving on to group 3, which is slide 30. And this topic was technology and how it might further marginalize. Who can speak from group 3?
Hi, I'll take the opportunity to speak from group 3. So we had a really good conversation when it comes to exclusive technology. I think it's a really important topic right now, as we all know. What we really kind of dove into was really looking at ways that we could include and be inclusive within our data collection. One of the adaptions and resources we worked on was talking about appointing women at government offices to support and make sure that there's a comfort level for women on the other line. So a big issue when you're doing data collection over the phone is the comfort level that you have when it comes to confidentiality, when it comes to talking to people, you lose that face-to-face. So making them as comfortable as possible. So if it's through a government operation, through a government office, really making sure that women are actually there talking to other women. Lessons learned, we learned a little bit from Joshua about the Nariri program and how they're really focusing on how you can do FGDs in technology. And he's doing, they're attempting to do them, still with a socially distanced platform of using microphones for everybody. And so, looking at how they're going to go ahead and do that. And I think it's a great opportunity. His key lesson was smaller FGDs. If you're going to be able to do any form of socially distanced focus group discussion, make sure that they're small and that they're a group that everyone can work with. And then our recommendations for future, Valerie really talked about, having done collection through the phone and really looking at disaggregating data, because what she noticed was that, they were only collecting from men at the beginning. And so by disaggregating that data and really looking at the data that they were getting and who they were talking to, she was able to adjust the selection process.
Thank you, Alyssa. Thank you. And moving on to group 4, limited resources for quality data. Can I have a volunteer from my own group to talk, please? 1 minute.
So I'm just going to volunteer myself really quickly in the interest of time. But given, we all recognize that we have challenges about, having current quality, deep data. And so ways that approaches that we wanted to take to kind of adapt to that was really the importance of integrating gender questions into other assessments. That is a way to save budget. Thinking about, what is the possibility of creating a pitch or a way to advocate for more budget and more understanding and importance on these gender indicators, but also looking at realizing that if you have a robust M&E system and you have that good data in turn will equal good budget. So you have to have those resources to show. So you have to have the data that shows that, yes, we need more information here and we need to invest more here, and the investment will kind of begets itself. So with that, I'll pass it on.
Okay, and finally, I would welcome someone from our Francophone group to share what you discussed.
Sure, I will share quickly, and I'm going to share both in French and English, so our colleagues are sure to follow.
Thank you.
Start with the English. Let me go down the slide. We talked a lot about how budget is limited, materials are expensive. There's not a lot of expertise in certain regions for qualitative analysis, and security concerns are an issue. Some recommendations were one of the projects had purchased in vivo software and tablets for the staff to use and had identified gender analysis experts and expertise in qualitative analysis. And I think just the budget theme kept coming up, need a little extra padding in the budget, a little extra room for flexibility. Donc, en français, ce que j'ai dit en anglais, en fait, on a parlé beaucoup du budget là, qui est limité au niveau du ce qui a été octroyé, et puis aussi on a besoin de, comment est-ce qu'on dit, un peu de padding, un peu de marge extra supplémentaire pour pouvoir faire des recherches complémentaires. On a parlé du manque de ressources humaines, manque de connaissances pour recherche qualitative, et puis des zones sensibles à la sécurité et comment regrouper des villages par clusters. Thank you, merci.
Thank you so much. So with this, so much appreciation for all of your time, and it's so nice to see your faces. And I will hand it over to Ellie now to close and talk about next steps.
Thank you so much to all of you. So following along on slide 37, if you could please click on the link and fill out the evaluation. We are learning along with you. Also, we have this unique opportunity, and then we hope to see you 2 more times in the next month. So with that, your feedback is incredibly important to us so we can accommodate you. Really, the information you provide only helps us improve. So please fill out that evaluation. We will share the notes that we have all compiled here today, so you have a record of everything. We also made a recording so that you have that information as well. And with that, we look forward to seeing you again. We are meeting again in 2 weeks, where we will, for our second workshop, where we talk about gender analysis. So now that we understand what needs to go into collecting the data, what do we do with that data? How do we understand all of that data? So we look forward to talking about that on November 24th. Again, thank you so much to all of you, and I will see you in 2 weeks. Take care.
Thanks so much, Ideal.
Thanks, everyone.
Yeah.
Thank you.
Thank you, everyone.
Goodbye.
Thank you.
Bye.
Bye.
Bye. Thank you.